Health Tunnel, one app for all your healthcare needs.
Hello everyone, welcome back to our Health Tunnel YouTube channel. So now let's continue our chat with Dr. Krishnamurthy sir. Welcome back sir. So my first question for today is, you would have been noticing that there is a lot of adulteration when it comes to grains or cereals or even the vegetables that they grow is like pasteurized, adulterated, and also the milk what we are getting is also pasteurized, and the meat for that matter are given injected with a lot of hormones, and then so that is giving a lot of effect on the human health. So what is your take on this sir?
See, present day food is completely adulterated, I agree. But there is another aspect of it, because we are living in a very fast society where our dietary habits are more of canned food, and we seldom eat at home. So thing is, it's adulterated, but we have our own choices. So we should prefer home food and something which is more organic.
True. Yeah. Okay, sir. Now me as a nutritionist, I get a client. Okay, so they'll have a lot of deficiency, like basic vitamin deficiencies. So I make that out by the symptoms what they're telling or sharing. So then we send them for a blood checkup. So they're scared first of all to get a blood checkup done. The second thing is, after they get a blood checkup done, we ask them to go and see a physician. Okay, so then they are very scared that doctors are going to give them medicines, but they don't know the difference between supplements and medicines. And they also ask me, so we have to take this, for how long should I have to take this, like basic B complex or even like omega-3 capsules. So all these are very basic. So what do you have to tell sir, like what is the difference between supplements and medicines, so that would give them a lot of clarity?
See, anybody who is going for an exercise or going to hit a gym, it's better to understand how is your body at this present state. See, the body, we have a regular blood tests and all done, and there are somebody who is suffering from comorbidities like blood pressure, hypertension, diabetes. So you can also plan properly when knowing his body condition. So that's the first thing, like your cardiac conditions, because you cannot make a person with a low cardiac ejection fraction to run.
Yeah, true.
So the first and foremost is getting the basic blood test. So you are not going to supplement them with medicines which they have to continue for life. You are correcting the deficiencies to make them comfortable and get the best benefits of the working out. So here, like again, a catch comes, like, okay, what should I take? So there are few things. One, like calcium, vitamin B12, vitamin D3, vitamin A, iron and folic acid. So these are few things we usually check, and a normal cardiac scan, so that easy fit at this present state to run, to do a cardio, or is exercise should be like graded exercises. So all these things we come to know by getting a blood test and a regular scans done before a work, joining a gym.
Okay, so what you're telling is, doctor, that supplements are not bad, right?
Supplements are
not bad. So those are not medicines, right?
Yeah.
Those are just the dietary supplements which they can't get from the food on a daily basis, so that they are supplementing with medicine. Okay. So now that you would have seen a lot of kids or the parents getting their kids with like diabetes at a very small age, like type 2 diabetes, or being very overweight, eating a lot of junk, or just being very sedentary. But 20-30 years, like when you were in your childhood, that case was not like that. So what do you think, doctor? Like what has changed drastically, or how do kids like have to change their like pattern, or what advice do you give to the parents?
The present day is an internet based society. We live in a fast moving pacing society where our friends are gadgets. So our children are attached to the gadgets. So there is no physical activity, and each child as such has a sweet tooth. So they would prefer sweets which is loaded with high sugars. So the main thing is educating them, educating the physical attributes, like what are the arm and what should you see before eating something, like whether it's a canned thing or something. You have to see what are the things which are there. If it is a junk food, see, this will be high in carbohydrates and also in high sugars. So they tend them to make them more obese, and present day internet, mobiles make their life sedentary. So first and foremost is allow your child to have at least one physical activity, whatever they like. Second, cut down the mobile and the gadget use to certain extent, because you cannot completely stop it. And making an educative thing, like you have to educate them regarding what's the good food, what should you eat, and balance the both the things.
True.
So that's the main thing is education and understanding the whole food biology.
Okay, so doctor, now that there's a lot of oxidative stress and inflammation, so there are studies saying that it's because of gluten intake and also lactose, that is the milk, like milk products. So again, why is this inflammation becoming a big thing nowadays? Now
Again, you came up with the same thing. See, thing is, any inflammatory change or any allergy to certain food, it is in which is done by our adulterated food.
Okay.
So you train your body, you take the same thing and you start changing it. So once your body sees it as an allergent agent, you will not be able to come out of it. So making the right choices of the food, and each person's body responds in a very different way. So you first the main thing about all these things is the food what we take. So basically we should prefer homemade food. So and also we should know what allergies we have, because each person is unique. So somebody will be very allergic to fish, somebody will be very allergic to eggs, and there are certain common allergies. So some milk, eggs, fish, then somebody will be allergic to this milk, all the dairy products. So you have to, and that is because of the adulteration of the food industry. So thing is, we are what we eat.
Yeah. So what you're telling is most of the food is genetically modified.
Yeah, 100%.
So
you want taste, you want it to look good.
Yeah.
So those are the things we have.
Very true, doctor. Yes. So coming to women health, so 8 out of 10 women who come to me are diagnosed with PCOS. So why is this happening again?
Again, it's a lifestyle disease. So thing is, hormonal imbalance, high carbohydrate intake, sedentary lifestyle. You cannot stress, and you cannot add genetics to this because this is how you bring up your body. So these are the few things.
And they come to us saying that they're irregular periods. So then they can't have a baby, they can't conceive.
This is the main thing is even at this present age, mothers don't educate their children at that adolescent age, so to understand their own body. So that's the main thing. See, the educating is the basic thing. You educate them to know themselves more. That is the first step for all these things. Then sedentary lifestyle, the most important thing. High carbohydrate, high fast life. So you want to eat high sugary food. So those are all the things.
Sleep patterns
are long mobile chatting, long hours of chatting, and your sleep will be decreased. So all these things contribute for the overall physical attributes of the person.
Okay, to conclude, doctor, so what are the 5 steps that people have to change in their daily routine to keep themselves healthy and going for a long period, like being healthy for a long period of time?
First and foremost is a good sleep. Second is homemade healthy food. Third is physical exercise. Train like from trained people. Get your blood tests like your present clinical status. Understand it. Then you can and more you should eat more of an organic thing, better homemade things. That's the better way. And also take proper micronutrients and macronutrients in your diet. So that's a big topic in as such. So you can just like once you understand it, it will be better.
Yeah. So it was a very informative chat with you, doctor. Our audience could learn a lot of things, like understand what is going wrong nowadays. So now I'll call upon Mr. Deepak Rajput, who is our in-house fitness expert, to continue the conversation. So he'll ask you more questions about fitness and like staying fit and healthy. Thank you, doctor.
Health Tunnel, one app for all your healthcare needs.